Jonesy and Amanda.
Jam Nation.
It's estimated that 1 in 20, or around 1 million people across Australia, have ADHD. But with excessive costs when it comes to getting diagnosed, that number is likely far greater. Well, it's about to get easier, with the Minns government announcing reforms which will allow GPs to treat ADHD to reduce wait times and costs. For more, let's chat to the New South Wales Health Minister, Ryan Park. Hello, Minister. How are you?
Yeah, good, thanks. Good morning to you both.
Now, until now, to get diagnosed, have you had to make an appointment with a psychiatrist or a neurologist? How's it been working so far?
It's a challenge. We know that we've got workforce shortages across our healthcare system, and for some people that can end up waiting 12 months to 2 years, and that's simply not something we want to see. So we've decided to make a change and allow GPs who undergo specific and additional training to be able to be involved in that prescribing those drugs needed for ADHD going forward, and for a small amount, they'll also be allowed to diagnose in that process.
I saw something on the ABC last year on a radio documentary they called Background Briefing, where they looked at telehealth and how easy it was for a lot of people to be diagnosed or misdiagnosed through telehealth. And there were terrible stories of people being given medication without proper diagnosis, and that conflicted the other medications they were taking with terrible results. Will this at least be face-to-face? Will people be able to be properly consulted by a doctor?
Yeah, without a doubt. And those doctors and GPs, despite the fact that they already undergo specific training, there will be additional training for them to be involved in this program. We estimate around 1,000 extra GPs will undertake this type of training, and then a small number of those will be involved in the diagnosis. Not the full 1,000, but probably around about 100. So there'll be different levels of training for which GPs can elect to go into, but this is all about making sure that people with an ADHD diagnosis can get access to that important medication as effectively as possible, while still making sure that it is safe and we're delivering the best possible clinical care to the patient.
Because you don't want it being rorted like the NDIS.
No, without a doubt, we don't want to see that, but I've got an enormous amount of trust in our GPs. They're a profession that I think people have a great deal of trust in. I think we've got some challenges across our healthcare system, however, in trying to allow people to access the prescriptions they need or the individuals they need. So we have to try and allow people within the system to try and work to our full scope of practice. We're seeing that we're doing that within our pharmacists at the moment, and this is an extension of that, using our highly trained GPs to undertake additional training to provide this type of care.
And it'll be a lot cheaper and a lot easier to see a GP than a psychiatrist.
Yeah, without a doubt. I mean, we know that psychiatrists are in hot demand at the moment. We know many health professionals are, and we know the work that they do is incredibly valuable. But we also know that it's important for people to get access to this type of support as quickly and as efficiently as they possibly can, and we believe that GPs are ready to take that next step and increase their scope of practice.
There you go.
It's a big initiative, make a big difference
there's stuff
for families.
happening. I was recently diagnosed with it, apparently.
You were?
With ADHD.
Well, I could diagnose you in a second.
And they said, well, we could do something about that.
You were diagnosed as an adult, were you?
Yeah, this is a few years ago. And I just said, look, I've learned to deal with it.
Yeah.
Mentally. But,
yeah. You scratched the surface, half our team here.
Well, someone said to me, you should take Ritalin and see what it does to you.
No, don't do that.
I'm not going to start.
Make sure you're going through the right way.
Yes, don't just rely on me.
You're not recommending I mind sweep people's medicine cabinets, right?
No, I'm not, mate. Don't do that.
I'm taking some of Amanda's estrogen medicine.
He's very perky.
Yeah.
Ryan, it's always great to talk to you.
I think this is a great initiative and will make a big difference for families.
Thank you.
Always good to chat to you. Thanks a lot for having me.
Thanks, Minister.
Ryan Park, our New South Wales Health Minister there.